Okay, we're going to get started with this afternoon's agenda. And I want to start by asking everybody in the room who had some of that amazing lunch to give a big round of applause for our Yukon U team. Thank you. That was really good. I eat a lot of lasagna, and that was so good that when the meat lasagna ran out, I had to raise my voice. We're out of meat, and Bella was right there with the second thing of meat. So it was good. And the apple crumble was delicious. So thank you guys very much for Yukon U. If you liked that food and you want to support culinary students, you can visit Yukon U's Bistro restaurant, which will be opening soon. They'll be open for lunch times that you can reserve at Yukon U Bistro reservations. I hear a rumor there may be a Taco Thursday night for those of you who want to get your Mexican feel on. And so stay tuned on Yukon U's website for that. Thank you. Thank you to whoever took the bike out of the room. Appreciate that. Just a reminder for the survey, if you can enter your name on that, you'll be entered into a great draw. So please take advantage of that. And our second graphic artist, Esther Burdent, I think, that I may have got the last name wrong, is set up in the multipurpose room. And so you'll also get a chance to see some of her fantastic work. So I hope everybody can hear us online. Yeah, good. We are going to move to our next panel. And I would say for those of you who have ever organized a Christmas dinner with 10 aunties, you're about to feel what that's like. Because we're gonna, it's okay, you don't have to. It's gonna be, there's one of those things as facilitators where you facilitate a panel that makes you nervous. This is my panel that makes me nervous. Because we're talking powerhouses across the board and lots of fantastic, amazing things to be shared. So please join me in welcoming our next panel, First Nation Health Priorities in the Yukon Territory. We've got with us, big round of applause. Woo! We've got with us today, Mathia Alatini, Diane Strand, Jill Charlie, and Vera Charlie, not related. Right? No, not cousins? Okay, just checking. And we're gonna get started with some important conversations. And I told Blair I was not gonna, hold on a second. I'm getting better with the microphone switch here, people. So.
She's a little bit nervous because we warned her we might go off script.
Yeah, and I said, I'm not surprised. To see other people in the room are like, yeah, Okay, so our first question for this panel. Can you share your thoughts on the top 3 priority areas for health research from a First Nation government or community perspective? And I'm gonna ask Vera to go first, but please introduce yourself before you go, Vera, and then go ahead and answer that question, then I'll work our way down.
I'm gonna introduce myself in my language. My Danki Nesen Cheda Uji. Lila Salmon Carmax, Ningji. I work for Dan Sotha No Lido. And I just said, my name is Vera Charlie. I'm from Lila Salmon Carmax First Nation. I work for the Health and Social Department for Lila Salmon Carmax First Nation. And I see on this booklet, everybody has a PhD. I don't have PhD, but I have PhD on the land, the medicine, and the people in my community. And the question I had here is drinking water, including the mining site, cancer, NIHB, dementia, drugs and alcohol, autism, and kidney dialysis.
Thanks. Thank you, Vera. That was beautiful. Jill, do you want to introduce yourself, and then you can share with us what your top 3 priority areas are?
For sure. Good afternoon, everybody. My name is Jill Charlie, and I'm here on behalf of Kwanlin Dun Health and Wellness. I'm the director there. And a shout out to some of my teammates I see here today. The priorities that when I was reflecting on this question that I came up with was it would be really great to see more research in kind of what actually Vera was talking about earlier, getting a PhD on the land, research in traditional knowledge and medicines. Our elders are getting a lot older and we're starting to lose that knowledge, and it's really important that we capture it as soon as we can. And I know that there is a lot of efforts underway to do that, and I think we just need to amp those up. And we at Kwantlen Dun, like that's something that we would really like to start, I think, diving more into is the use of traditional medicines so that people have them available to them. And we're not just having to pick from the Western medicine cohort. And then the second one, that priority that I had done some thinking about was really around addictions and mental illness. I mean, it's a big topic here, of course, across all of the world, but in the Yukon, we've all, I think, lost somebody probably that we know over the past couple of years, and it's been really tough. Sorry. I think within this, we really want to learn how we reach out to our youth better. Sorry, I didn't expect to get emotional on this. We definitely want to learn how we reach our youth better and just how we can help prevent them from engaging in these behaviors before they become a problem for them. And also, I think as a second part, I mean, we have a lot of folks who already are struggling with addictions and mental illness, and I don't think that we're necessarily doing a good enough job right now at helping them. And so I'd like to continue to explore and implement ways that are more meaningful, more on the land based, and giving people access to, things that are going to help them. I know Dr. Gabor Mate, his research that he's done on psychedelics and such as like MDA, there's groundbreaking evidence behind this stuff. And because of laws and things, preventing us from accessing them, these are things that are not even accessible necessarily to us up here. So I would like us to figure out how to push back on that and be able to incorporate some of those stuff along with, building more opportunities for on the land healing and better access to that. We don't want to continue to drive this type of culture underground, and we really need to bring it up and open it up. One of the things actually that Kwantlen Dun is looking at doing, we just recently acquired some lease space downtown, and a few of our departments are looking at opening up a collaborative outreach space in order to help serve our clients better that live in the downtown core. We know that it's a barrier for them to even though it's not very far up the hill, but getting a ride or walking up there when it's cold like it is out there today, they don't want to come up there. They're down there, and we want to be able to position ourselves in a better way for them to access the services that they need and help us engage with them better. And then on my third one is really looking at decolonization of the healthcare system. And I know all of the ladies up here actually have done a lot of work on advocating for this. And I think we just need to really keep promoting this and pushing it. And Kwantlen Dun happens to be in a really unique position within the territory because we've got a fairly robust set of services that we're able to provide for our citizens and for the other First Nations that are in Whitehorse. And I think the NUCA model is probably something that most people have likely heard of, and it's just a different way of accessing care right now. How the healthcare system works is it's largely like you have to see a physician before you can access any other type of healthcare in the territory, and I think that that's wrong. And I think we need to be really pushing to change that and figure out how we can make that happen faster. And I'm hoping that Kwantlen Dun can be like a leader in that area, just because we're not necessarily tied down so much by the bureaucratic system of Yukon government or of the federal government as well. So with that, I will pass it on.
Thanks, Jill. And I often hear, don't apologize for your emotions. It is hard. And it's fair to be emotional, and I appreciate that emotion because we all share that. So goodness cheese. Diane.
Dunje, a ganzanusho gotan, echika a uye, ejetje. My name is Ekika, or if you can't say that, you can say Diane. I belong to the Crow Clan, and I'm a member of the Champagny-Jacques First Nation. I am very happy and excited to be here, and I thank the people of the ancestors and the people of today and the people yet to come of the Kwalindun First Nation and the Ta'anquatchon for allowing us to be able to share with what we can with all you folks. I live in Haines Junction, and presently I am the executive director for the newly formed not-for-profit society called Shothan Naji, Healing with the Land Society. Got to be careful with what I say because board member Tosh is listening to me. And that's our society has been formed because one of the things that we do is work with families out on the land. We do energy healing, which is what I am an integrative energy healer, and equine therapy, art therapy, play therapy, and we do all of that on the foundation of ceremony and being out on the land. And that to me is the biggest key of what a priority that we really need to do is all of our healing has to happen out on the land. I have been, I had worked for my First Nation for a number of years, and I know that many of our frontline staff would drive into Whitehorse with some of our members that would want to go to the treatment center, Sarah Steele, and then they would turn around and come back, or many of our members would say it just isn't, it just doesn't accommodate them. Being out on the land is the biggest key. There's been a lot of research right across Canada. The Thunderbird Foundation, Partnership Foundation, has done some extensive research, and being out on the land is number one key. And it doesn't really need to be something that is like confined, like here in Whitehorse, you could do the exact same thing. So when I think about some of the priorities, I was also several years ago, I was on the expert panel with the Yukon government, and we created a document called Putting People First, which Jill had alluded to. And I know that Mathia is gonna go crazy on this one because she's worked so hard on trying to get Putting People First forward. There's two things in that document. First of all, I really think the Yukon government and other governments need to put their foot forward and really implement this. But there's two things. There's the Wellness Yukon, which is a Yukon Health Authority, which Dr. Smart had alluded to this morning. She had talked about the authority, and that authority is something that is really needed because some of the things that like I just heard Elder Smith over there telling me all of these things that, is a priority, and the authority, which Kwalindun is completely set up to be able to have the NUCA model system. Just Google NUCA, N-U-K-A, and it's a system that is in Alaska that brings people from various communities together. It is an incredible model, and Kwalindun is really set up for the idea is that all of this would happen within all of the Yukon, not just Whitehorse, but hubs all over the Yukon. And in the Putting People First, 4.1 recommendation was talking about on the land healing. There is commitment from Yukon government to look at the funding and develop partnerships with Yukon and federal government to have land-based healing. And when we think about land-based healing, there's so many. I'm going to just step back just for 1 minute. I am not a researcher. we had this little discussion at lunch. None of us are researchers up here. You researchers out there need to be able to pull out what it is that we're saying so that you can then go, oh, that's a good research topic. Because I know that there's research in there somewhere to be able to prioritize. Right now, we have over 200, CYFN, Council of Yukon First Nations, has over 200 people that they have sent off to treatment out of territory. They're engaging right now with both federal and territorial government on developing our own treatment center here in the Yukon. It's going to be several years out. It's going to be quite a few years out before we can actually let that happen. But there are research that needs to be done before it actually comes to fruition. One of the things is our capacity. We need to have a workforce strategy of what it is going to take to have a treatment center here. The word out there is that there's 1.5 staff per person. So if you have a 28-bed facility, you need about 70 people. And do we have that capacity? And when I talk about we, I'm not just talking about the Yukon. I want brown faces in the treatment center. That's what I want. We need to be able to develop the capacity of our own people here in the Yukon, and we could, Dr. Smart talked about that too. We could do that training here in the Yukon. That means that there has to be a lot of healing that comes with the training, because many of our own people, myself included, have had to, and I still go to a therapist. We need to be able to work through our own stuff to be able to help other people. And so we need a huge influx of healing dollars coming to help our own people, and then those people can then be able to help others. It's a cycle that needs to happen. I'm going to keep rambling here. My brain just went somewhere else. I just had a discussion with Canor. I don't know if anybody knows who Canor is. Canor is a funding agency, federal funding agency, and their key is economic development. So they will provide all kinds of money if you can prove that there's an economic development need. And so I'm having this discussion with them about capacity building, and they're like, well, that's not economic development. And I hate to say it. I feel so, I'm going to start crying here to sit there and think that, yes, the healing field here is economic development. It is so sad that we have to have an influx of people to be able to be counselors, energy healers, traditionalists, ceremonialists, psychologists, all of those, every modality that you can think of, reflexologists, we need them here. And that is economic development, to increase our workforce in these capacities. That is, and we need the numbers. So you researchers, dig out the numbers and help us figure out what those numbers are so that we can go to Canor and say, we need the dollars. Yeah, but 10 years ago, they sent off all these people from the Yukon all across Canada to learn how to do underground mining because of the mines that are here in the Yukon. We now need a huge influx of money to be able to train our own people. When we talk about treatment centers right now, when I say that CYFN has sent off 200 people, those 200 plus, those 200 people have come back, and some of them have been able to make it, and some of them have not. And one of the biggest pieces, what we traditionally call aftercare, it is now called recovery supports. We do not have the recovery supports capacity here in the Yukon. And the recovery supports is what's needed right now. We can't wait 5 years for a treatment center. We can't wait for governments to sit there and decide that they want to, help us with on the land. We need the recovery supports now because these people are coming back. They're hungry. They are so hungry to learn and to be healthy. They want to be healthy. They want to help their own people. And we need to be able to give them the supports that they need so that they can go ahead and do that. Anyways, I can keep going, but I'll pass it on to my pal.
Thank you, Diane. Lots of powerful words. I'm going to turn it over to Mithia, who, and I won't publicly shame this person, who asked me earlier, was my younger cousin, Mithia, coming? So I'll introduce my older cousin, Mithia.
Thanks, Tosh. I love that, whoever you are. Danche, ING, Media Uye, Kluan Man Kai, J, Kajat EJ, Ama Gadia Ata Ken Wilson. My name is Medea Alatini. I'm a member of Kluani First Nation from Kluan Man Kai. I am the daughter of Mary Jane Johnson and Ken Wilson, and the granddaughter of Lena Johnson or Tulason and Fred Chambers. I have been working for the past 2.5 years, mainly in COVID response for First Nations, and working as a contractor with CYFN and looking at how best to keep our community safe, bottom line. All of that work has really brought to the forefront a lot of holes in the healthcare system. The weaknesses, we can see that throughout the pandemic, not just in Canada, not just in the Yukon, but globally. The pandemic has really exacerbated any problem areas within the healthcare system. And just to echo the fact, I am not a researcher either. We are doing a couple of research projects, but I'm definitely not a researcher. And I'm much more action-oriented. If I see a problem, I am much more task-oriented and will look at how can we solve this problem and solve it now, and not afraid to fail. I think that's something that you have to learn in the Yukon, and if you don't get it right the first time, try again. So I think that's a lesson that I'd like to put on the table for all of us here. We're at a point in our healthcare system where we have to start doing things and not be afraid of failure. I think failure is just reiterate, what's the next thing going to look like? So that question about the top 3 areas of the healthcare system or healthcare research, the first one for me is really, and this is supporting the work that Diane and the panel had done through putting people first, and the work that Kwalin Dunn's doing with the healthcare system and providing indigenized healthcare at Kwalin Dunn. I think, how do we look at indigenizing the healthcare system? How do we bring the holistic values of share, care, respect to healthcare? How do we look at it as more than just, okay, you've got something that's obvious, a broken leg, you've got something that is very physical, instead of looking at what has happened in your past, looking at the collective grief. We've got 2.5 years of not being able to gather, not being able to celebrate the people that have left us. We've got, what are we at now? 21 opioid deaths this year. And that's a lot of grief for us to process. So how do we look at things a little more holistically? Yeah, this whole piece about the whole person. So look at their spirituality, and that's what the land. There's so many studies. Japanese have been telling you, oh, if you feel bad or you're feeling stressed out, go take a nature bath or a forest walk. And that is proven to make a difference. So of course, our traditional ways of healing, of being on the land and recognizing that the land heals, is it needs to be integrated in the healthcare system, full stop. I think there's also this piece around what we put into our bodies. So the thing of teaching youth about food, about wellness, about how to take care of their bodies from the inside, from what they put inside of themselves, and how that will reflect on their whole health is super important. And I don't think, I mean, doctors don't take courses in food psychology, or look at how many people are obese in our nations. We have diabetes, and all of this stuff could be solved with food. So how do we incorporate Indigenous values of only taking what you need, being respectful, into a healthcare system that looks at that holistically? So indigenizing healthcare system, food wellness, and food as medicine. And my third priority, which is so directly a result of COVID, is we saw the opioid increase, opioid use, opioid deaths, all of the resultant systemic issues that come out of opioid use. One of the big pieces that comes out of opioid use is a sex trade. And I had the opportunity to co-present at the International AIDS Summit in Montreal earlier this year, and learned so much about how when you look at these types of pandemics or challenges, the response to challenges, you see the opioid use, but with that comes the sex trade, and then with a wave right after the sex trade is all the sexually transmitted and bloodborne illnesses that come out of that. So within the first 6 months to a year after the opioid crisis, you see an increase in things like chlamydia, gonorrhea, syphilis. And we just had a press update, what was that, like 3 weeks ago, a month ago, about a syphilis outbreak here in the Yukon. So this wave is already hitting us. It's peaking. We do not know how bad it is because the sex trade's underground. So that piece that you guys are working on having a multi-pronged effort of having a place where people can go that's trusted, that ends up being a place where you can get diagnosed, you can get assistance, and it is without judgment, is so important. So after that wave of treatable sexually transmitted diseases, so things that can be treated with antibiotics, you end up having the sexually transmitted diseases that you have for life. So think Hep A, B, C, HIV, AIDS, and yeah, there are medicines to keep you from dying from that, but how do we get diagnosed? How do we get treatment to those individuals that are not going to go and wait for 4.5 hours over at Emerge to go get a sexually transmitted disease test? It's there's a lot there. I can think of like 20 research projects just on that alone. So with that, I'm going to leave it.
Thanks, Cynthia. I don't know anybody else that could connect nature baths, dry meat, and syphilis. It's impressive. Okay. There's some breadth to that, people. Lyris, you got your pen out? Okay. Question number 2. I'm going to start with Vera on this one. What would strong partnerships with Yukon First Nations around health priorities look like from your perspective?
Working together in partnership, sharing information, sharing duties, driving community members who are not Little Salmon Carmacks First Nation citizens to the appointment in Whitehorse. Quarterly meeting to provide updates and planning for future workshops. Bringing service to the community that are not available here. Not enough resource in our community.
Thanks, Vera. So good reminder that not what we don't always have what everybody has in Whitehorse, and we need to focus on that. Thank you. Jill, same question?
I would say capitalizing on our trilateral partnerships that we already have in place and just making them stronger. And I think Often, I feel like the voices at those tables are missing the service providers. I mean, there's great leaders out there, don't get me wrong, but I think there's a disconnect often between what is happening at the service delivery level versus what's being said at the leadership tables. And so we need to get plugged in better there. I think it would be great if we could build stronger relationships between First Nations too, and really be learning from each other, both within the Yukon and outside of the Yukon. I know BC is doing some really amazing work in the First Nation Health Authority, and I often look to them to see kind of what they have researched or what they have shared on their website. And I think just also like for governments that we're working with to remember the capacity, the lack of capacity actually sometimes that it's slowing us down because we just don't have enough workforce there to be able to lift all of these pieces up, and we need help there. And keeping the funding coming to support our efforts and really ensuring that the priorities that are coming out are driven from the community and not the other way around.
Good, thanks, Jill. Diane, so just a reminder, what would strong partnerships with Yukon First Nations around health priorities look like from your perspective?
So I think it was Dr. Zoe in Northwest Territories had talked about stories, and our good friend here who spoke, I'm sorry, I never did get his name from the Dene man. I wrote down what you had said about stories. Stories is something in your mind is going to connect. So strong partnerships is listening to what we have to say, and listening with an ear that is coming from a different value perspective. We may tell you something that you may think is something different, or you may believe it one way, and we're actually saying something that is really rooted in who we are. It's within our cell memory. And stories are one way that we could, looking at our traditional stories. So University of Victoria, Dr. John Burrows, who is an Ojibwe, did this project there through the Indigenous Law Research Unit. And what they did is that they looked at traditional Indigenous stories through the lens of interpreting their legal rights and perspectives. So it was through the law unit. So here's a really good research project that they broke down the stories to look at their laws. Like, what does this story really mean? What I'm thinking that what we need to do is look at our traditional stories to look at it through the lens of a health perspective. What is that story actually really telling you? You can have one story. We have this story, I'm just quickly gonna really, hopefully I don't make a mess of it. We have one story about the blind man and the loon. And the loon helps this blind man with his sight again. Now, that story, you can interpret it in so many different ways. From a health perspective, we think of how the blind man was able to go and use the water as healing, how he was able to do ceremony as part of his healing so that he can see. And the other piece of that is the reciprocity. When the blind man gave the loon a beautiful necklace, and that's the ring around the loon's neck, that is the reciprocity of saying thank you, and you have helped me be able to see. Looking at our stories from a traditional perspective to really dig deep into what traditionally our elders and ancestors were saying to us, or teaching us. And this is really, really important. And because I'm gonna talk about our spirituality. You know, when the RCMP came into our communities, and it happened all across Canada, but when they came into our communities, we no longer practice potlatches or reciprocity or any of our spiritual beliefs. And those spiritual beliefs are, they're there. We have it. Our community members have it. Somebody had said that, oh, it was Dr. Zoe who said this, but that we have our own healers. We do, but many of them are afraid to step out, and because that is cell memory, they feel that they're going to be ostracized, or that they're not going to be looked upon in a way that anybody would trust them. We have lateral violence quite rampant within our communities. And so if you come out that you can do traditional healing, people might look at you differently. And we need to be able to break that barrier. We need to be able to really fully understand and make spirituality something that is of the day right now. And I think we can do that by looking at our stories, to be able to go back to our elders and really break these stories down in the same way that Dr. Burrows did at UVic. It's an incredible model. And to be able to break it down and to really say, what are these stories saying about how we can help each other and how we can heal? So to me, that is a really good way of going and working within First Nations, because then you're looking at their values of who we are as individuals and as a nation.
Great, thanks, Diane. Mathia?
So I had that whole thing as recognize Indigenous ways of doing, which is learning through story. My other points, and maybe just to add on to the recognizing the lessons learned through story, because that's a very Indigenous way of learning and teaching. But when you're looking at integrating healthcare systems, the Western model is it's very patient and doctor orientated, or patient and caregiver orientated. And that's not how our communities function. We function as families, we function as community. And that, you know, the saying, it takes a community to raise a child, is actually true. You rely on your aunties, your uncles, your nieces and nephews to help out and to provide care and to provide healing. So I think that integration of family and community into the healthcare system, and that addresses, like when you think of that, it addresses so many of the capacity issues that we have. It's an auntie doesn't have a healthcare designation, but they're healing. and yeah, there's a lot that community and family can give to the healthcare system, or bring that to any sort of partnership. When I'm thinking about the healthcare system and the research that's being conducted, especially this this framework, so patient-oriented research, I think one of the things that we have to have, and this is bridging that gap between the First Nation or Indigenous ways of knowing, doing, and being, and the Western model, is we need an MOH, so a medical officer of health. So that's different than a regular family practitioner or a family doctor. A medical officer of health is actually responsible for the entire population or an entire community. And we need one that is looking out for Indigenous people, that is speaking for Indigenous people, that is bringing that Indigenous lens to a healthcare system that is very rigid. And I think we need to build in that flexibility. So in order to shift or change, we need to have that. Yeah, it would be great if he's Indigenous. She or he, yeah. And then the other piece, and this kind of goes along with the integration of family and community, is the decentralization of care. So what we saw throughout the pandemic was the abilities for communities to take care of themselves. They knew what was required. They knew what was necessary in order to bring the care to individuals. And we're really good at taking care of our elders. We're really good at taking care of our youth. And we know what boundaries we need to put up, what kind of safety measures need to be put up. And we did it. We did it faster and better than YG. But no, but I think that just proved that there is capacity. Yes, it's constrained, and yes, there are, like, we need more of it, but we can solve our problems in community ourselves, and that needs to be recognized in this relationship. There's nobody that's going to come into a community and say, oh, I'm the expert, I know how this should be done, and that's going to go over well. No. So I think ensuring that there is that forethought of decentralizing care, or how can we best deliver care in community, is, yeah, that's it.
Thanks. That's it, she says. Also, thank you for not dropping the mic. That's good. Okay, last question, and then we'll open the floor for questions from the audience. Vera, can you start us off with, what do you think SPORE and its partners need to consider when addressing Yukon First Nation health priorities and research?
The dynamics of the community and service that are needed here for people who aren't able to travel to Whitehorse. Mobile service would be wonderful. Foot care, massages, acupuncture, cupping, physiotherapists, dental service with all community and prevention training.
Thank you, Vera. Jill, same question. What do you think SPORE and its partners need to consider when addressing Yukon First Nation health priorities?
When I think about this question, what the phrase that comes to mind is, we have to think outside of the box. We can't approach research in the way where I think it's been historically done. Like, I think we have to consider the capacity within First Nations, the amount of engagement that is already happening. Like, I know in Kwantlen, we collectively, just amongst our own departments, had come up with over the summer that we wanted 32 different opportunities to engage with the citizens of Kwantlen. And I mean, that's before we even start looking at research. So people are tired of meeting, I think sometimes, yes and no. Like, I mean, we want it to be fun. And so think outside the box when you're reaching out to people, and really understand, I think, how to connect with them in a different way than how it's been historically done. Yeah, I think that's it for me.
Dan? What's the question? Yeah, that's good. What do you think SPORE and its partners need to consider when addressing Yukon First Nation health priorities and research?
First, can I ask SPORE to change the name?
Okay, here's the rogue part. I was like, woo, we almost made it through that. You can
Dr.
ask.
Zoe did that in Northwest Territories, right? And yeah, when our good friend has emailed me 15 times, where's Shayna? She did wonderful. She's absolutely awesome. Yeah, every time I seen SPORE show up, I was like, what is that? So no, so that's just a little bit of an aside, but he did. He mentioned that he changed the name to an Indigenous name, and that might be something that is of value. To really look at, I guess, in absolutely no disrespect to Yukon University or to the unit or anything of that nature, but it would be really nice to see brown faces, there, so that we could actually have, and why I say that is because we talked about the values, and values, no matter, we are all colonized. Everybody is colonized. And there's times when I have to check myself because, having an education in a Western education, I have to check myself and go, okay, is that really from the lens of my ancestors? And so if I have to do that, heaven to Murgatroyd for other people having to do that. So if you have people that have the Indigenous,
Helen who?
I'm really dating myself, am I not? Okay, some of the people in their 50s would know that cartoon character. Pardon me? Snugglepuss, yes, that's who it was. Thank you.
Okay, focus.
Yes, focus. Ground. The values of the Indigenous people need to be able to come right from the bottom and all the way up, so that when you have a full gap, and people can have as much intent as possible, but when you have the actual values of where you come from, that will be continuously on the forefront. So, that's.
I'm like,
I'm sure there's more there.
heaven to who? What? Repeat the question.
So the question is, what do you think SPORE and its partners need to consider when addressing Yukon First Nation health priorities in research?
I think there's already a lot of foundational work that has been done. So this speaks to the point of don't go out and do another survey. God, my eyes are going to roll out of my head.
Except for the evaluation survey we put in the link.
I think do some background research on what's already been done. Do your desktop studies, do that work before you go and ask the same question again. Look at having the joint conversations. So if it's all Yukon First Nations together, bring everybody together. Have the joint conversation about what the priorities are, because I think this one-off, one-on-one conversation, what's your priority, it's problematic when you don't have the opportunity to hear what your neighbors are talking about and to hear and bounce those ideas off of each other and really come up with what is our priority. When we think of ourselves as a small Yukon community, what is our fundamental priority or priorities? I had some cheeky ones. I was like, listen. So the other one was integrate the holistic healing. So really looking at building relationships, building connections, and looking at what was laid out in Shaukwaa, or putting people first. How do you support that work that was already identified? That was you guys did a lot of work. You visited every community, and this was pre-pandemic, but honestly, that work's been done. Those priorities haven't shifted that much. How can you look at supporting that work that's already been identified, that important work? Because building a healthcare system that has an Indigenous voice is the fundamental outcome of that report. And how do we drastically shift what the healthcare system looks like here? I see Shaukwaa, or Wellness Yukon, as something that is very fundamentally different than any other healthcare system that we see. And yeah, it can emulate Nuka model, it can have all these other things, but it's going to be something that's uniquely Yukon, and it's uniquely Yukon because it's going to have an Indigenous voice. So how can you support that? Yeah.
Sorry, I have to add something to that. Thank you. My brain wasn't functioning there. Thank you so much. Yeah, one of our panel members, my goodness, I forget his name. and I spent so much time with him. He had said that he's a doctor from Toronto, and he has done a lot of this type of work that we had done on the panel. And he had said that if the Yukon actually does implement Wellness Yukon, Shokwa'a, we did do that, not all of Canada is going to be looking at the Yukon. Every healthcare provider will be looking at the Yukon to see what the successes would be. If we were able to implement, there were 74 recommendations, get on those recommendations and let's do it so that everybody can look at us.
Awesome.
Yeah.
And they're getting feisty. I'm good. You can hold that one. So you don't want to give Josh from Burwash 2 microphones. It's not going to go well. It is 1:48. We have time for some questions. So here's a challenge out to, no, not quite done. You have to answer questions. A challenge out to our virtual participants. If you've got a question, we haven't heard much from our hubs and from our virtual participants, so we'd love to see some questions from there. And we're going to take a question or a comment from the floor.
Yes,
Jesse, can you help?
I just broke it.
There you go. You got her.
My name is Norma Maymarie, and I've been hitting the Yukon since 2017. And I'm going to have trouble speaking, but I'm going to try. I lived at the Salvation Army for a whole year while I found a place to live. And the thing is, so many people went to detox and they had no place to come out and go to. They need a halfway house here in Whitehorse, and all the places, so that they can go and stay there, so they don't have to go back to the shelter and end up back in the same situation. And I believe very, very much that we have to get back on the land. We have to heal us. When I have problems with my heart, I think I put myself out in the middle of nowhere where I want to be, and I just go in that little box, and that's where I stay until everything calms down. Thank you.
Goodness, geez, thank you. And I thought you did fantastic. It was well said.
Thank you.
Any other questions or comments? Yes. Come on down. It's like Price is Right.
Do I get a prize?
You can have a apple crumble.
Oh, it was really delicious. Sorry. My name's Sophia. I'm from Vancouver, from the British Columbia Centre for Disease Control. I'm not English. It's an Australian accent, before you ask. Thank you all so much. I really resonated with a lot of the things that you were sharing, because I do research with people who are in prison as partners. They're not patients. And I really struggle with the patient-oriented research. So I'm just really interested to know what we can give as the suggestions to SPORE for what they should change the name to. I just say community partners, or just partners, or co-investigators. But yeah, I really would like to hear what your thoughts are, because it is a very colonial way of thinking about the people that we're working with, right? And it does seem a little bit paternalistic. Yeah.
Great, thank you. Panelists, any comments? Any name suggestions instead of patients?
Just let me, I guess I'm not quite clear on what you want a comment on. Oh, what they can change. First of all, I want to be really thankful for SPORE. I am really thankful. My previous life before I got into the health field was in heritage anthropology and archaeology. And I am so thankful for the women that came to the Yukon and researched us. I'm thankful for that, because it's in written books now. And if we didn't have that, then the oral history may not be as rich. We have incredible oral history, But when we're able to pull out a manuscript or a book, we can trigger people's memory and they're like, oh yeah, yeah, yeah. So I'm very thankful for researchers. So what could a name for SPORE be? I think what we could do is we could have, we have an incredible group of young people up at the Yukon Native Language Center. It just warms my heart so much. 5 years ago, I was so worried that Native language we were not going to be able to have it, that it was dying. It was dying. I thought it was going to be dead. And now I go to a potlatch not that long ago, like a month ago, and there was 2 young boys, they were in their early 20s, and they were sitting side by side, and my nephew was across from them, and the 3 of them were talking in Southern Shoshone. I was like, oh, I was so, so happy. And to hear what these young people at Yukon Native Language Center is, and they're young, they're really young people, they're fresh out of high school. You know, there's my niece is teaching, and she's a powerhouse. And I know that your nephews, you know, like there's so many people up there, young people, they can help SPORE come on with an incredible dynamic name.
Great. Thanks, Dan. Matthias, something to add?
Yeah, I just wanted to address your comment about housing or halfway house. I think that's one of the big things, like Maslow's hierarchy of needs. You got to have food, clothing, shelter. So having access to safe, adequate housing is essential to healing. And that spectrum is that diversity of that spectrum need is very apparent. And I think it requires everybody taking some action in how they can address the housing spectrum needs.
Great. Thanks, Cynthia. Got time for one more comment or question. Do we have anything online?
Before you go on, can I just make one
Yes,
quick comment?
of course, Jill.
What you had said about calling people patients or clients, I totally agree with you on that. I think that it automatically puts a power dynamic in there. And so I think actually the NUCA model, if you look at it, in Alaska, they actually refer to people as customers, owners. I'm not sure that would fit here for the Yukon or not, but I think that that's something that we absolutely should look at addressing and to help change that power dynamic in the relationship, because it really is that person who is seeking the healing, no matter what they're in, like they are the ones who should be in the power position.
Nice, Jill. Thank you. I don't know if you want to call the prisoners customers, but good point for people in the health system. Good. Yeah, Elder Diane.
With spores, one of the things, sometimes the elders will tell you before you can deal with the situation I'm in, like, you need to get to know who we are as First Nations people. You need to get to know us. And also, when we look at non-insured benefits, we get the secondhand treatment. Like, we don't get the brand name medicine, we get the, what do you call it, the other kind, generic. And also, one of the things that really got me to really think, and the work that I do, is that the blanket exercise is one of the most way of getting to know who we are as First Nations people. A long time ago when the gold rush came up, our people were affected in many ways. This one miner put arsenic in a baking powder can, and that family cooked bannock for supper. The next day, that whole family was wiped out. They were poisoned by the arsenic. Yukon has a painful history. We have the missionaries, the Hudson Bay, the Alaska Highway, the gold rush. The pandemic is another one that's new. We had people that were never ever receive, over 500. All of a sudden, they're getting 2,000 a month. And I witnessed a young, beautiful First Nation woman that just depended on that $2,000. And within a matter of weeks, she was turning yellow Then she ended up back on needles again and ended up ODing. So when we look at what happens to the community, the First Nations community, you need to get to know us. You need to know the history. You need to know the pain that we live with each and every day. And also when we're diagnosed with a disease, like I've been diagnosed with fibromyalgia, carpal tunnel, arthritis, and they just gave me the name and that's it. Gave me painkillers. That's it. But never ever let me know what fibromyalgia really is until I asked the nurse, can I get a printout from them? That gave me a better understanding of how to treat myself. When we go to the hospital, it's diagnosed with you got diverticulitis. That's it. And then you got allergies. You know, with a whole bunch of food allergies. When I was diagnosed, I didn't know what the heck I was supposed to eat. And then I went over and asked the dietitian, and all she did was gave me a printout and say, here. And only to find out, and then I couldn't sleep. I was scared to eat. And then I finally went over there. I said, am I going to die from my allergies? She said, no. I said, gee, that would have been nice to know right up front. So when we look at the non-insured and also the treatment that we get, my sister Leslie was treated with hemorrhoids. The doctor was treating her for hemorrhoids only to find out that she had colon cancer. And then because we are covered by non-insured, and when she was passing away, she said, I was not sent to the best cancer hospital in the world. So we're always like getting the, how you call it, the generic treatment, or because you're First Nation, you're just treated like a drunk. I've been asked if I was a drunk, you know? So there's a lot of that, that stuff that comes out. When we look at the history of TB, when our young people are, when our, like Auntie May was diagnosed with TB, she was sent to Charles Cancer Hospital. And a lot of them never came back. I remember this one woman was looking for her brother and was treated in Charles Cancer Hospital. She finally found her brother and she wanted to bring his body home to do a proper burial for her family. And when they phoned her and said, sorry, we can't, and she said, why? She said, because there's 5 other people buried in that same grave. So you can see just by those few things that I share, the history that we carry is painful. And a lot of times, you know, we look at, we are brought up not to get hurt. When we're out on the land, we have to be very careful. We're not allowed to get hurt. We were raised like that. And then only to find out that, you know, like when we, I'm all over the place here. When we, sometimes too, like when Kwanadan has a program called Pathways, and that's to get our citizen people out in the workforce. And we talked about starting at Duska, our daycare, do a lot of our teachings there about drugs, alcohol on the land. I don't know how many people, when they go past the city limit sign, they feel free. You know, you're no longer in the city limits, and the natural land just touches you. I remember one time I was out on the land and I was camping, and there's one young girl said, can I come out and spend the night with you? I said, sure, come on. So she came out, and then she said, I'm dealing with something. I said, okay. So I let her come out, and I had a little motor home. And then here, pretty soon, I look out the window, she was hugging a tree, like just hugging it. And then next time I look out, she was laying on the ground. And then I was running out of water, so I told her, we got to go get water. So I went down to the river, and she said, let's just sit here and listen. So we sat there, and she started throwing rocks, and then she found a rock that warmed up in her hand. She said, I'm keeping this. And then when we were heading back, the wind was blowing. She said, let's stop somewhere so we can listen to the wind. So we did that, and then here we got back to the camp. We had supper, and then she said, are you going in town tomorrow? I said, yeah. And then she said, good, she said, because I got my answer. As First Nations people, we are people of the land. The land has everything to offer us. It has medicine to abort a child. It has medicine for the sexual transmitted disease. We have medicine out there, roots, and even creek. An elder went to see a Chinese doctor, and that Chinese doctor said, go to a creek and just drink that water. And so she went back to see him a month later, and she said, yeah, all I did was drink creek water. He said, you're okay now, because the rock has minerals, the lichen, the different plants that are in the water, there's medicine there. So this is who we are as people. The land is the one that we heal from. We don't use the word treatment up at Jackson Lake. We use healing from the land, because treatment is different than the way we work with our people. And also sometimes when we go to the hospital, you know, I remember I got scared because my daughter had the same name of a young woman, and they said that the young woman went to the hospital to outpatient, and she was bleeding. She had a really bad cut, and she was bleeding really bad. And so she'd see that the emergency door wasn't going to be open for her. She stood there. She finally turned around, got back in the car, and the young woman that was in the First Nation room went to the front and asked that nurse, how come you didn't open the door for her? She's bleeding. She said, I'm just tired of it, she said, that woman at the desk. I'm just tired of it. So when we look at the world of health and to get to know who we are as First Nations people, each community is different. Each community has history. Each community has pain. So we need to look at individual communities. We're not all the same. Not one of us are the same. I remember my niece telling my sister, don't label me like my brother. I'm me. I'm not him. So, you know, those are some of the teachings that we have as First Nations people, and it's really important to us. So when you look at the history of how many people were treated for TB and we were used as guinea pigs. I remember one auntie that passed away, and she asked the doctor, how come you guys can't help me? I need to know what's going on. So I called her. She said, call so-and-so. So I did. And the doctor told her that because you were treated at Charles Council Hospital, he said, inside of your lungs is all full of candle wax. And all your veins are all over the place. So that if we did operate on you, you would bleed to death. We wouldn't be able to save you. So these are some of the painful history that we also carry about being misdiagnosed and can't be treated because of what happened to us in residential school, what happened to us at the hospital at Charles Council, but not only that, the residential school. If we don't deal with our trauma, our body becomes dis-ease. And you find women that have cancer, breast cancer, or ovary cancer, and it's because of the sexual assault and a lot of the things that happen in the residential school. So, you know, so the Yukon, you know, we carry a very painful part of our lives. And a lot of times people say, get over it. Sorry, we live it each day. Thank you.
Goodness, cheese.
I know you said one more, but I want to be one last one.
So I'm just going to say we are over time, so you have to be brief.
As a frontline worker at Whitehorse General Hospital for the last 14 years, I can relate to all the stories that have been told. But one of the things we haven't talked about is like systemic racism. And also, I need to mention that just because I think it's an education item for the doctors and the nurses. I no longer work at the hospital. I appreciate the learnings and the teachings they provided me for the last 14 years, helped me get my education in social work. So presently, right now, I'm with Corcus Tigers First Nation as their one of their executive council members. But health and healing is priority for me. And when we think about collaboration, I think we need to look at it, as she said, collaborative approach, a holistic approach. But what does that mean between alcohol and drug services and children and family services, the hospital, right? Because each one looks after their specialty, right? We're not really looking at the holistic approach. The thing that I find lacking is the medical model will, as our elder said, will treat your disease, whatever it is, the pill, radiation, a needle. But we forget that we also have to deal with the spiritual component of our health and well-being. And that's the foundation of who we are. Like our elder said, and other people said, the connection to the land. So the medical model will work for some people. Yes, it is needed, but our Indigenous ways of knowing and being as well. So education about connection with our doctors who just come up and go. They're not here very long. With the nurses, I mean, being there for 14 years, I've seen and experienced racism that is shocking. And people know that we live in trauma every day as Indigenous people. Me, my mother went to residential school, so I'm a next generation residential school survivor. Even me knowing this, I have to watch how I talk to my patients. I'll just give you one example. A nurse, the male nurse, was coming out of a male patient's room, and I was going in, and the patient said, "I don't like that guy." And I said, "Why?" And he said, "And because I like this nurse, he's one of the better nurses, I thought." And he said, "Because he keeps calling me chief, and I don't like that." And my learning, when I was leaving, I went to go flick out the light. I said, "I'll just turn your light out for you." He said, No, please." He said, "Bad things happened to me when I was young, and I always sleep with the light on." So simple things like that have to be looked at. The education of who comes and help us to help ourselves. Some of our doctors and nurses are really great, and they go out of their way. And our program at First Nations Health, we honor pre-birth to post-death. And last year, we opened up our little private ceremony in the healing room to honor the people that we worked with that passed away. And we lost 67 First Nation people last year. December 31st, we honor these people. And we do keep track of who we lose. And like someone said earlier, COVID has magnified the overdoses, the suicides, all these negative things. I remember the first time when we lost somebody and COVID rules hit. It was quite sad to see, because we're told to protect yourself, a nurse trying to comfort somebody who just lost their son. Both of them were wrapped up in sheets. It was like, it was awful to experience that. And as I was, after everything, I was escorting the mother out. And I said, "I wish I could just hold you." She said, "Me too." She said, "This is not our way." And after that, I became a little bit braver and did what I needed to do my job. But anyways, I thank you for this opportunity, Tosh, and I thank this, opportunity for research, but I think it has to be opened up to look at the holistic approach to our health and well-being and name those things that interfere with us.
Thank you. Goodness, Chase. So I think what we've heard today is just a very light piece of a much bigger conversation, and I would say we need to create more space because there's lots to be said still. So can you join me in giving a big round of applause for these amazing ladies and their contributions?
Thank you.